Thank you. Paul?
Yes, good afternoon to everybody. My name is Paul Reid. I'm the licensing manager at Stratford-on-Avon District Council. And part of our role and remit is to issue and authorise licence consents and notices under normal circumstances, which is even more important now in the COVID-19 situation, where we're seeking to offer guidance and assistance to enable business to comply with existing legislation and indeed to offer assistance with regards to COVID-19 regulations. That's particularly important in some industries, especially the pubs and club industry, which has taken a large hit due to COVID-19, but especially with taxis as well, which are a vulnerable group, yet still provide a valuable service within the town. So we are here to offer that guidance and assistance, and if anybody should want any information which isn't on this webinar, feel free to contact Stratford District Council or indeed any other council direct on that basis. Thank you, Ian.
Thanks, Paul. Aaron?
Good afternoon, everybody. My name is Aaron Coursey and I'm from Warwickshire County Council and I work within the Town Centres and Tourism team. We've been working with our local partners, the districts and boroughs, the business improvement districts and chambers of trade, etc., across the county while the COVID-19 pandemic's been around for the last 12 weeks. Within the team itself, we work closely with all the individual districts and boroughs, looking at how we can best strategically pass on all the messages across the whole of the county regarding safe reopening, how everyone's working together, wellness, kindness, and all about the partnership approach to what a town centre is going to look like and has to look like going forward. So I welcome all your questions later on today about how we can continue that partnership working.
Thank you. Emily?
Hi, I'm Emily van Deventer. I'm Associate Director of Public Health with Warwickshire County Council and jointly employed by South Warwickshire CCG. So I usually and continue to lead around mental health and well-being from a kind of mental health and suicide prevention aspect, as well as promoting well-being. That's obviously still a priority during the current time, but it's also been, as you can imagine, all hands on deck in terms of preventing and controlling the outbreak or the pandemic from day one. A range of partners that we work with in terms of offering that support, advice and guidance, care homes, schools, businesses, and currently busy around the test and trace agenda as well. So happy to attempt to answer any of your questions at all today.
Thank you. Daryl? Daryl, I think you're on mute.
Sorry, I unmuted it, but it took ages to take effect. Can you hear me now?
Yeah.
Sorry. I'm Daryl Townsend from Warwickshire Fire and Rescue Service Fire Protection Department. We are the enforcing authority for fire safety, and although that sounds all very heavy-handed and a bit overbearing at times, we're very much in an advise and assist capacity as well. The fire safety order, however, has not had any relaxation or amendments due to COVID, so our advice and our assistance is as it would always be, actually, in terms of fire safety in buildings. If people have got any questions today on that, then we're more than willing to help. One of the most common questions that's come up over this period has been how to deal with doors, and in our world, fire doors, and whether they can be held open to prevent contact because of COVID. And the answer to that is they can, as long as it's an automatic device, but they can't if it's things like gate hooks or tying back, or the good old one of using a fire extinguisher to prop the door open. So they can't be a manual or a physical hold open. They do have to be automatic. But again, the detail of that and any other questions people have got, happy to answer them today or any other time. Contact Fire and Rescue. Thank you.
Thank you. And Paul?
Hello there, good afternoon. My name's Sergeant Paul Calver. I'm in the Harm Hub in Warwickshire Police. I've been sitting on the COVID group with Jonathan since the start, many months ago now. You may have seen in the press the way the police have approached COVID, and for Warwickshire, we've taken a very much the 4E's approach with members of the public and businesses alike. That is engage, explain, encourage and enforce, with enforce being the last option that we take with businesses. But there are options there for us should we need it. But we would prefer to engage and explain and encourage people to do the right thing. Whilst police do not have powers to enforce social distancing under this legislation, we're quite often the first point of contact that we're called by the public when social distancing has been breached. So if the premises that are maybe opening in July, if those issues arise, it may quite often be the police that actually may turn up on your doorstep because we've had that call. So please engage with us, work with us. We're there to help. We're there to try and guide you as well and help you with these problems. So social distancing at the moment obviously is still 2 meters. And while that's in place, obviously we will get those calls, which has happened since retail is open, and I'm sure will be the same when the hospitality opens. Obviously with licensing itself, the police play a big part in the licensing. We all know from central government there's different mixed messages coming out about when and what and how and everything will be opening. We are very much in the same boat as everybody else when it comes to this, and we are waiting to hear. And obviously once we're here, we will be working with people. We will try and work with everybody to ensure everything is safe when we know what is happening in the future. We do envisage the fact that when pubs and clubs and restaurants are allowed to fully open, there will be a large turnout. There has been for every other retail sector that's opened up when they've opened on the first week, and we expect the same. So we would ask that all premises that are opening in July or when they can, please do have those risk assessments in place, but also have those plans in place. Plan for it to be busy, plan to make sure you've got those enough staff that are on duty so you can control whatever venue you are allowed to open and whatever areas you're allowed to have, that they are under control and they're under your control and not down to the authorities to do that for you. So we really ask that you please plan ahead and plan for it being busy. Thank you.
Okay, I think the message there was about planning and getting prepared. If I was to pick one overriding message. Okay, well, thanks panel for your introductions. We've got some questions that we've received from various sources, and perhaps we'll have a look at those, and when we've dealt with those, we'll open up to the guests on the call. So the first question I have, which is a general one really, is about the 2 meter social distancing rule. Do we know if that's going to change or remain the same?
I can add my first thoughts if you want. There's nobody speaking. I know there's a lot of pressure, especially from certain hospitality sectors and retail sectors to have that reduced to 1 meter. Certain places it changes their capacity from 30% up to 70%, just that 1 meter difference. But obviously it's down to central government to make those decisions. And I know it's been in the news recently, they are having it up for review, and I expect it to be reviewed before the 4th of July, whatever decision that may be. But obviously I'm not a health person, so I can't say on the calculations they work it on. I'm sure it's based on the R number and different factors like that.
But if you are planning, you need to plan for the time being, certainly for 2 meters.
Yeah, definitely plan for 2 meters, because if it doesn't change and you plan for 1, your plans will be totally array. Because like I said, your venue capacity could go from 30% to 70% or the other way around, depending on which way you've planned. Yeah, okay.
I'm happy to give there's a perspective from public health. So obviously we are waiting for that review and decision by national government. Currently the evidence is based on the kind of spread of droplets when somebody coughs or kind of shouts. So it's still safest to be as far away as you can, I suppose, within that 2 meter distance. We may still see that distance come down, but just for your individual protection and when you're thinking about staff, I think it's still sensible to kind of keep the distance as and where possible.
Thanks, Emily. I've seen a couple of hands go up. I don't know who put their hand up first, but I'm going to go over to Jonathan, if that's okay.
I'm going to let Paul go first, Ian, because I know his hand went up first. So just for politeness, I'll let Paul answer first.
Cheers, Jonathan. Thank you for that. Really, it's just to say that people should be undertaking smart and sensible risk assessments. So they should be looking at doing a risk assessment for the 2 metre, and then as and when it decreases to the 1 metre, because inevitably it will, then you can move swiftly on to the 1 metre assessment, and then they should be thinking of planning for when there's none, because they still should be looking at improved hand washing and any other gel wipes. Thank you.
Jonathan?
So the thing I'd like to add, which I hope resonates with people on the webinar today, is whether we say it's 2 metres or 1 metre, there's going to be a lot of things we need to consider about people's own personal choices and the personal decisions they want to make that they think is going to keep themselves safe. And we've spent 12, 13 weeks getting people into the mindset that 2 metres matters. And for many people, that's still going to be the same case. And what's been really noticeable for all the premises that have opened up and all the businesses that are now operating is an absolute focus on how people feel, their own personal perspective, and that very personal support that so many of the businesses that be on this line today can give, whether you're in the personal care sector, hospitality sector, accommodation sector, all those things that are opening up. Spend your time and effort on the planning about the care of those people who are using your services, and allow them to do that flexibility about whether it's 2 metres or 1 metre. Some people will be delighted it's 1 metre. There'll be a lot of other people out there that actually for 2 metres, it's about their own personal safety and their own personal perspective. So please, please, please spend your effort and your time working with your customers and your clients and your staff, and think about their welfare and their own personal perspective on this. That's definitely the best way forward. Let's not get hung up on whether it's 2 metres, 1.5 metres, 1 metre. This is about people's perceptions on what will keep themselves safe based on the environments they find themselves in.
Thank you. Some very helpful advice there on planning for the 2 metres for the time being. So moving on to a more specific sector question, I suppose. I'm sure there's lots of people who are looking forward to hairdressers and barbers reopening. I certainly am. I've got one here from a business. I'm a barber, and I wondered if I'll be expected to wear PPE, and if my customers will also have to wear PPE.
Shall I take that one? So again, we are waiting for the national guidance, obviously, for the sector to confirm this. We have some comparisons with our care sector, so social care and domiciliary care providers that obviously have to provide close personal care. Now, currently they are asked to wear full PPE, so face mask and apron and gloves. However, that is considering the fact that they're working with a sicker, more vulnerable cohort than largely barbers and hairdressers would be working with on a day-to-day basis. So our expectation, but it's only that at this stage, is that face coverings would be required, because you will be within that 2 metre distance when you're working with a client. I expect it would be required from the barber or hairdresser, and perhaps advisory for the customer. So that's about protecting your customer, really. So the face coverings don't necessarily give you protection, but they will protect in terms of transmitting to others. So do keep people safe. And obviously we've seen the requirement come in for face coverings on public transport, and again advice around them being used in an enclosed space. So if you're inside a home or inside a shop, that would be deemed in an enclosed space, and you'll be within that 2 metre rule. But as I say, I expect it will be face coverings rather than kind of clinical PPE, if you like. Yeah. To touch on gloves, I mean, I don't know what they say on that yet. Again, a kind of personal conjecture really is that they may require gloves, possibly more if you're going into somebody else's household to protect yourself than when you're inside your own premises, which you can obviously keep on top of in terms of the cleaning routines.
Okay, thanks, Emily. Anybody else want to add to that? No. Okay. So sticking with the hair industry, if you're operating a salon, will you need to clean down your salon after each customer? Will a chair need to be cleaned down after each customer? I'm not sure if they already do that practice.
I don't know if that's standard practice. I would suggest it's advisable. So certainly, thinking about those high contact areas. So armrests on chairs. Obviously, if people have been given a cup, you would wash that. And just being sensible, really, about the areas that people frequently touch, and giving those a quick wipe down with soapy water, and then like a Milton type disinfectant as well. That would be prudent, I would say.
Yeah. Okay, thank you. Anybody else?
Hi there, Ian. If I could just quickly come in. I think we can also learn lessons from the shop branches that have opened this week, putting in similar regimes of cleaning. So normal retail outlets that have increased their cleaning levels, and it's about that customer focus. Again, following on from what Jonathan said, different customers will want a face covering if they come into certain hospitality areas or personal care areas, others may not. And also it's about transferring that knowledge to your customers and explaining to them why you're doing it, that you are cleaning, that you've changed your regimes, and it's about that communication. So I'd stipulate that as a good practice, that you're telling everybody that you're doing, because again, it's all about the customer.
Yeah, and you talked before, Aaron, about reassurance and actually turning that into a positive sales pitch to your.
Absolutely, yes, it's about that positive message to your customers, to your staff. Obviously, we're always ensuring that your staff, the risk assessment's been undertaken for them as well, and they're safe. But key is that customer that's coming in that will want to come and spend some money, want to come and have a treatment, come in for a facial, etc. And we're all craving these wonderful things that we're missing, that sort of social interaction. And it's about making it right for the customer and the staff.
Okay. Emily, did you have something else?
Yeah, so I just thought I'd come back on obviously hand hygiene, and if you can encourage customers to use hand sanitizer or ideally soap and water when they come into your premises, and that obviously reduces the risk of any indirect contact with those high frequency surfaces we've mentioned. I'd also suggest obviously speaking to customers when they book, but also when they arrive, just to double check around any COVID symptoms that they may be experiencing. So the key ones are a new continuous cough, high fever, or a change or a loss in sense of smell or appetite. And so putting those measures in, again, you will be reassuring people that you're operating safely. I think for this sector, actually also having tissues readily available for clients while they're sitting in your chairs, in case they do need to cough and sneeze. Obviously, they can do that in a way that reduces any potential spread as well.
Is it worth displaying anything in your business? So I know the government, when they produced the sector guidance, they produced some steps that businesses will have taken, and you can display that in your business. Is that a good practice?
Yes, would certainly advise just keeping customers informed, just highlighting some of the key measures that you're taking, and giving that level of expectation management, really, so that they're not surprised when you're asking them about any symptoms that they might have had, or asking them to wash their hands.
Yeah, thank you.
Ian, can I just raise a point? That basically is a question for Emily, really, on this, with regard to beauty parlours, hairdressers, barbers, etc., etc. How much detail would you want them to record of the persons that are booking for test and trace purposes and things like that? Because obviously it's a close proximity sort of business and things like that.
Yeah, thank you. That's a really good point to raise. So we would expect there to be a requirement for bookings when the national guidance comes out, in terms of helping you to manage your numbers. But also it will be really helpful for us in terms of that contact tracing activity, should a positive case arise that has been a customer of you or amongst your workforce. So we would want to know an individual's name and contact number. That's all we need, really, to get hold of people. Email addresses potentially, if people are uncontactable by phone. So yes, would put a plea out there that you could help us with the test and trace system and really getting on top of this pandemic by helping with contact tracing in that way.
Okay, thank you. I did see another hand up, but it's gone down, so I think, should we move on? So sticking with the hair sector, we have a question here from a business that's hiring a chair in a salon, and they're supplying their own PPE while they're dealing with their customers. And they've been told by the salon they're hosted in that the only measures that they're taking for the salon is to install a screen at the reception desk. So who will be policing correct practice in these businesses? And is that really all they need to do to keep their customers safe? So there's a couple of questions in there, I suppose. There's one around minimum measures, which I think we've already discussed. But I suppose then the question is, who is policing these measures?
Can I just probably, with that terminology, I'll probably jump
Sorry,
in on
Paul,
that
that's
one
an
first.
unfortunate terminology. I mean, policing.
Yeah, I mean, no, it's quite a valid point because, as you know, we quite often will get the calls. The public will quite often call the police when there's issues at premises, when they think somewhere's breaching or such like, because it's the number that everybody knows rather than the local authorities. We may attend, depending on what the allegation is of such. But what will happen, obviously, is part of this partnership group, it will be recorded and will be reported back to the local authorities and the relevant agencies who have that, you know, the responsibilities for whatever the breach is as such. So from a policing aspect, we may visit, we may engage, and we may advise, but the actual relevant authorities will sit elsewhere within the partnership group when it comes to those sort of in-house type operations.
Emily, do you have your hand up?
Sorry, that might have been an old hand.
Oh, okay.
Yeah, apologies.
Anything else on that?
I mean,
It's up to businesses really to police them, well, to put the right practice in place themselves, isn't it?
I think we've mentioned a number of those kind of minimum measures in terms of checking symptoms and keeping hand hygiene hot on the agenda, and cleaning. The screens and the kind of whatever the minimum distancing is at the time of opening will obviously need to be adhered to. But as has been mentioned, you know, often members of the public will raise these things with police, and if individuals do have concerns about the workplaces that they're working within, I think you could also raise with the police, or I would assume trading standards perhaps within that too.
Okay, thank you. Louisa, you have your hand up?
Yes, I do. All it is we've had a couple of questions on the meeting chat that are around about personal care, and I didn't know if we wanted to look at those now while we're on that section.
Yes, yeah.
The first one was from Gurdeep, which was, can you give clarity for beauty salons and how do we deliver treatments like facials safely?
Is there a taker for that question? It's a bit out of my area, I'm afraid.
I can have a stab again. I mean, I think the challenge for us all at the moment is that word clarity, because as we all know, we are waiting for the national guidance and we do have to take that on board when it comes out, of course. So again, I think it would be really pertinent, particularly in terms of facials, to be making sure you are asking about those symptoms. So again, fever, continuous cough, or a change in sense or of smell or taste. Again, wearing a face covering is likely to offer some protection, although, as I've said, it's more about protecting the person that you're working with in case you were asymptomatic. You could look at measures, you know, so you're not kind of face to face with the person that you're giving a facial to. So if they do happen to cough while they're there, you kind of easily turn away or stand back. And obviously asking people to cough into their arm, into their elbow, if they do need to do so. Yeah, I mean, I suppose I want to offer some reassurance as well that transmission rates are relatively low, so the risk of infection is coming down across that population level. But obviously, I think the key thing is the screening of symptoms in that scenario. And beyond that, I'm not sure we can give too much more clarity until that national guidance is released.
But take a name and a telephone number for test and trace in case it's needed. Yeah. Thanks, Emily. Jonathan?
I'm not sure why I put my hand up for this one, but perhaps it's experience as my mother was a beautician and did many facials over the years. And the thing, I suppose, just answering to Gurdip's question is I would do two things. I think one is to talk to your team, talk to your staff who are delivering things like facials, and walk through the process with them. And apply some of the things that Emily and the guidance will say. So how practically would it work in a way that can reduce your face-to-face contact with that person, and in a way that you can minimize the length of time you might have that direct contact with them. And I think the advice that I would say to you, particularly working in the beauty industry, is there's certain types of activity that you can do which will be easier to apply when you start to open. And there'll be other things which you might just want to hold off or test, and then actually to start to build into the business once you're comfortable and your staff and your customers are comfortable with how it's going to operate. That's the most important thing. If you try and deliver everything that you've done before, right from the word go, you might find that you end up with some of those challenges. So think about those two things. Walk through the process. And then also think about how you would then apply the different types of your business, and whether you would bring them up slowly in terms of the practice, so that actually then you end up with your normal business, but actually you've been able to do it in a comfortable way where your customers and your staff feel that you've increased it. That would be my advice to you.
Okay, thanks, Jonathan. Gerdit, was there any follow-up on that, or those responses been helpful? Well, do let us know.
Yes, it was useful. Thank you. There's obviously lots of areas around there, and we do need a lot more clear guidelines around it, but that's been really useful. But yeah, we'll probably need to wait for more guidelines.
Okay.
Thank you.
Thank you. Another question from participants here, which perhaps we'll deal with here. So Amy asks about, can you give opinion on sneeze screens and if they are required? I have mixed information on their benefits and their negative considerations regarding dust and virus particles being drawn to them with static. Is that something anyone on the panel has given any thought to?
So again, I'll have a stab at this one. I'm no expert on screens, sneeze screens. I think it would very much depend on the size of the screen, the location, obviously exactly how they're implemented in terms of their use. I can see potential benefit for perhaps nail salons, so where you have got to be kind of face to face with somebody, so a physical barrier could be helpful there. I don't know around the static and dust being drawn to them, so that is a risk. I think the thing to be aware of, it's a bit like visors, which you see in use sometimes. They won't necessarily give protection all the way around, if you like. So a visor is protective in terms of protecting your eyes, but not for protecting your mouth or your nose. So obviously, if somebody coughs while they're wearing a visor, you will still have that kind of downward flow. So I think it does depend, as I say, the size of the screen, how it's positioned, as to whether you might have kind of flow around the edges or underneath of the screen. So I'm always a little bit wary with things like this, because they can sometimes infer a false sense of security and protection, and perhaps make you be slightly less careful in some of the other measures you do. So I think, I'm not saying yes or no to them, but just consider very carefully where they are positioned, and I don't think that by putting that in you're fully protected and you don't need to do other things like the hand hygiene and the symptom checking, etc.
Okay, thanks, Emily. Amy, did you want to follow up on that? Or
Thank you. With that, it's predominantly at reception desk. I know a large amount of salons, beauty and hair salons, are putting them in place. Obviously, they look great, and I also appreciate they probably allow a little bit of comfort for the receptionist as well, working behind them. But I am really on the fence, because you're right. I think putting it up will actually create a false sense of security, and potentially may reduce other people's awareness and other people's actions that they are more important. So again, I own a business with Gerdip, and I'm just at a crossroads, I guess, as to whether we put that in or not. Yeah, I mean, in that scenario, when it's at a reception desk, it's probably quite helpful. So to go back on what I've said, I think it's only quite a short period of time, if you like, when the receptionist and the customer will be talking or kind of face to face or in relatively close contact at a reception desk. So you've got less risk of transmission in that scenario anyway. So it's just an additional barrier. I think I was thinking more if you're sitting for a prolonged period of time, having a screen in between you may not be as protective as you think it might be. No, thank you. I understand. Thank you. Again, it depends so much on the size of the screen. Sorry, I can see there's a follow-up. Is that Amy as well? Around sorry, you'll probably get loads of questions off me and Gerda. Yes. Again, just in our environment, there's been talk about using fogging machines, obviously, to sanitize the area and the space. And also elements of air purification. Obviously, you can't negate 100% of the risk, but I'm wondering what anyone's considerations are on those, if they're a benefit, if they're no good at all. I'm not suggesting them in terms of replacing cleaning, but as an additional benefit. Has anyone got anything they can share with on that? I'm just pausing to see if anyone's more of a technical expert on this than me. Otherwise, again, I'll have a go. So I think I would have some hesitation around machines that circulate the air. So certainly it's a good idea to increase ventilation within your workspaces, but bringing fresh air into the building rather than circulating. I don't think there's any evidence of effectiveness of air purifiers in terms of kind of taking bacteria or viruses out of the air. And I think I'd feel a little bit cautious around fogging machines. I think there's just a risk that you're creating more water particles within the air, which the virus could potentially attach itself to. If somebody was going to cough in that environment and then you've got all these water particles in the air, it gives it a way to kind of potentially travel further. So that is my opinion off the top of my head, but I will do a little bit more digging on that one as well. Thank you. Thank you. I'm conscious we've spent some good time covering personal care sector, so perhaps we'll move to hospitality. We can come back to personal care a little later if we need to. But so in terms of the hospitality sector, we have again a few questions here we've had already in. This is from a pub. So we're a pub and we're open for takeaways. If we are open and trading, do we have to comply with all of our license conditions as normal?
Do you want me to come in on that one, Ian?
Go ahead, Paul. Yeah.
Okay. Yes, they should be looking to promote the licensing objectives because that's part of the Licensing Act 2003. So yes, they should be doing with that. They should be doing that. Additionally, that they need to be complying with the times as well that they're opening. So if their license is only till 11 o'clock, they shouldn't be opening any later than that. So yeah, they still should be seeking to comply as much as they can. However, there are always reasons for non-compliance, and if those reasons are valid under the current situation that we're in, we in Stratford will be happy to look at that. And if there is some leeway that we can mutually assist each other, then we'll definitely give that some consideration.
Thank you. Any further thoughts on that?
Yeah, just from myself, from a police perspective, obviously we, again, like I said earlier, we're trying to be consistent across the county when it comes to this. So obviously, if a premises has got conditions on their licence, they are in place and they're on that licence. If they need to think about going forward under COVID that their licence does not allow them to do certain things that under COVID they need to be able to do, then they need to, as soon as possible, get in touch with their local licensing authority to discuss that with them. Have that conversation. It might be the case, it might just be a minor variation. It might be the case it's something a little bit more larger than that needs something else. Or it might be a case that they're just saying for the licensing authority, yes, you can do that. But they need to discuss that with their licensing authority, because again, the police will get notified, because residents, etc., will tell us a pub is breaking these conditions or breaking that. They'll tell us, we'll go along. We then have to look at the enforcement aspect of it as well as everything else and report that back to licensing authorities. So the biggie again is plan ahead. If you think you're going to have an issue, especially when we know on the 4th of July what's going to happen and what people can do, there might be people that specifically can't do that because they've got certain conditions on the license. So they need to engage with their licensing authority as soon as possible. Okay.
Thanks, Paul. Did you have a follow-up, Paul Reid?
Yes, thank you, Ian. Just to really complement what Paul just said, we are looking at a lot of variations for premise licenses at the moment, and license holders should have seized the time that they had, the previous 12 weeks, to look at their license to see if they need any extra capacity to undertake any additional functions that COVID-19 is actually presenting to them. And we are looking to offer minor variations to some premises where normally we may be considering a full variation, but we're trying to work with industry to keep them going as much as we can.
Okay, thank you. So picking up another question here. This one says, my DPS is self-isolating. Should I name someone else in their place?
Yeah, I can pick that one up as well, Ian, if you want.
Yeah, thanks, Paul.
It's like when DPSs go on holiday or DPSs are normally sick. If it is that it's going to be for a short period, then that's more than okay. And usually licensed premises have got more than one license holder, a personal license holder on the premises anyway. So they should be looking to actually write a letter, a brief letter, to say that the responsibilities of the DPS are transferred to Mr. X for, it's usually a short period, 2 weeks whilst I'm on holiday. At least there's something auditable and something traceable for us that we can look at. I wouldn't expect a transfer of DPS for a 2 week, 3 week period, in all honesty. So again, if it's going to be significantly longer and it's going to be over a month, then they may want to look at that. But under normal circumstances, I would say no, you wouldn't need to transfer your DPS in that situation.
And the DPS, that's designated
premises supervisor. So the old licensee, effectively under the old 64 Act.
Thank you. This question is, I run a pub. Can we sell alcohol for consumption outside of the pub in the garden? I'm assuming this is from next month. It's not clear.
Well, as it stands at the moment, for now, no, they can't. Not within the curtilage of their premise. So if it's their garden space, then no. If it's beyond that and they've got an off license, then yes, that they're permitted to do that. Moving forward, I don't know exactly what the 4th of July is going to bring. However, I do anticipate that alcohol sales will be permitted, probably outside and inside to a greater or lesser degree. But the outside would probably be permitted, but we'd have to wait till the 4th of July to see exactly what's going to happen then.
Can I just come in on that as well, Ian, please? With regard to that and what Paul's just said about the anticipating of what may come in on the 4th, I'll go back to what I said at the beginning about premises need to plan in advance, plan for this, especially if you're thinking about using outside spaces on pavements and things like that. How are you going to control this? What measures as a premises are you going to put in place to control that? So looking at every opportunity that you may have, but also putting measures in place that will then control those opportunities. to prevent people walking off down the road with glasses in their hands as weapons or whatever. It's preventing disorder directly outside your premises or noise from your rear gardens as such. Because you've got to also bear in mind that everybody's actually been used to a bit of peace in the nighttime economy, and that's not a negative towards any nighttime economy. But residents and things like that have been used to a bit of peace in the nighttime economy. Come the 4th, potentially that's going to change. So we need to sort of factor that in as well when we're planning ahead and what measures you're going to do with regard to controlling venues.
Thanks, Paul. Paul Reid.
Yeah, thank you, Ian. Just to echo what Paul has just said, we will get some complaints. There's no two ways about it. Moving forward, when licensed premises do open and they utilise the outside space significantly more than they had done in the past, under the situation that we're in at the moment, I think that's to be expected. And licensees, DPSs, do have a responsibility to manage their patrons whilst they are on their premise license. So they should, while they're on their premises, so they shouldn't actually neglect that management responsibility.
Okay.
Can I just get there, Ian, Paul?
Yeah.
Following on from both Paul's comments, again, it's about that communication. So as well as all the licensing rules, you're going to also have a partnership with your neighbour, with other businesses that are opposite you or next to you, and the residents that are also on the street. So again, it's about that communication, how you tell people what the rules are, what your policies are with regard to queuing on the high street, or because pubs, for instance, won't have the ability, like personal care, to have a booking system, so we'll be able to sort of negate a queue outside, whereas pubs, we may see queues forming. So it's all about that communication with your neighbours and with the Chamber of Trade, with other business representatives in the town, about how you're all going to work together to manage the place around you, because we'll all want to be doing things, and it's about that balance of the nighttime economy, the daytime economy, etc.
Can I just to add to that as well, Ian? Well, obviously we're talking daytime and nighttime, but what we don't know is what time the regulations will change. If it's a Saturday, then obviously people may come out to start enjoying the sort of licensed premises offerings in the daytime. So the licensed premises need to plan for that as well. So they need to anticipate that. So if they are going to have people outside their premises in town centres, what are they next to? Are they next to a shop that may also have a queue outside their premises? Because we just don't know what time this legislation is going to change, or it might be midnight on the 3rd into the 4th, but we don't know. So they need to anticipate that as well. Like they said, what premises are they next to, and what issues may that cause, day or night?
Yeah. So we're clearly still waiting for the guidance, but there's lots that businesses can do to think about how it might work in their particular circumstances. Okay, thank you. Louisa, I see your hand up.
Yes, we've got a question from Jared, which says, as the nighttime economy returns, will there be an increase in the number of night buses available where social distancing will be easier than in a taxi?
Good question. I'm not sure if we're in a position to answer that at the moment, though.
I think that'll be very much down to supply and demand, won't it, as well, I think, in going forward.
I would agree with you, Paul. And again, that would be something that Stagecoach or a commercial provider that supplies the area would be looking at that as a commercial venture. So if someone like Stagecoach or Johnson's, etc., can see the benefits to them as a business, then that might be something that they do.
But I don't think as a panel we're aware of any such plans at this stage. No.
I would just chip in to say the best and the safest way to travel in terms of COVID and your wider health is to cycle or walk wherever possible.
Don't cycle after alcohol, though. Thank you.
Oh, thanks, Paul.
It's a good job we have a balanced panel with all these different interests. Thank you. Okay. So skipping back to the hospitality, the personal care sector. Question here from somebody running a beauty business from home. Will they be able to trade from the 4th of July and allow people into their house to give beauty treatment? I suppose this goes for mobile beauty treatments as well.
If I take the legislation bit first, and then probably Emily will take the public health bit. But obviously, unless the legislation changes with regard to people in private houses, then that won't be able to happen. If that makes sense, in a private house, being indoors in someone else's house, unless you're in that social bubble. So that would obviously have to change first before anything else came in. But obviously, Emily will have probably an input on the public health side.
Okay.
Yeah, thanks. As Paul mentions, it depends whether the kind of home starts to be recognised as a workplace in some scenarios. I would encourage, if possible, you could think about, could you provide some of that in an outdoor space? Have you got a garden which you could perhaps put a little setup in, bit of an awning or something, and do it that way? And that would, even if you're allowed to operate from inside your own home, that would be a safer way of doing it anyway, because as I say, you've got all that ventilation around you, and there's lower risk outdoors, hence why we're allowed to see friends outdoors, not indoors at the moment. So yeah, that would be my tip based on the kind of current position. And if things do change, then I think it's just being really clear about, if people are coming into your home, obviously making sure you're really on top of cleaning regimes in your own home. And if you're going into other people's homes, to be conscious that they might not be as strict as you are in cleaning your own home, and to think about wearing gloves and certainly washing your hands as soon as you get into somebody's home and before you leave.
Okay, thanks, Emily. Conscious we're coming towards the end in terms of time, and there may be some questions from the floor. Jonathan, you've got your hand up.
Yes, I was going to try and answer some of the questions that Amy and Gurdip have asked, and I'll see if I can cover them off. And please come back if I haven't done all of them. So. Just going back to this bit about the screens and the reception, just to reinforce what Emily's been saying, the most important thing is about cleansing and hygiene. That's the most important thing. So if you put up screens because you think that will actually protect your receptionist or any of the customers coming in, again, it's a personal choice, but actually the cleansing is really important. There's no point putting a screen up and then not having a really good cleansing regime that goes alongside it, because that's when things do land on surfaces and remain. So you have to really think about how you're going to up that cleansing routine. It's really important. So questions being asked in terms of arranging with reception, whether you should have a receptionist or whether you should actually have people who actually come in and see the therapist directly. The really important thing I would say to you on this one is it's all about planning. The most important thing is not to allow queues to form. So if you can have a good booking system, whether it's via reception or whether it's via the therapist directly, what you don't want to do is have lots of people waiting in receptions to see therapists to have a certain type of treatment. That's the thing you need to try and avoid. And that's the best thing to do, have the best booking system in and really think about how that will work to minimize that. And if that means keeping gaps between certain types of treatment, then that's the best thing that you can do. And I know you asked questions about should there be a certain number of treatments or certain number of clients a person would see each day. It all depends on the treatment, doesn't it? You can have a certain treatment that may only last an hour. You could have highlights that could take 2.5 hours, 3 hours. So you've got to really think about the type of treatment, and then also at the end of that about how you'll then clean the working stations down, clean the chairs down, make sure that things are properly ready and prepared. Use all those hygiene things that Emily's talking about ready for your next client. And again, I go back to the advice I said earlier. Start with a minimum number. Don't start as if you would normally do it, and then build the gaps in that allows you to do all those cleaning regimes and minimizes the chance that people will actually be queuing. In terms of commercial waste, and you're talking about waste things and PPE, it's really important you bag PPE, you bag things that you've been using within your treatments, you treat it as commercial waste. Talk to your commercial waste supplier that's providing for your service, and make sure that they understand the waste arrangements. It's not necessarily about recycling centres, it's about using your commercial waste supplier that you've got for your business, and have a conversation with them early. Talk about what times they might be coming, what times they might be collecting, etc., and just make sure you deal with that. The way the virus operates, it will last on certain surfaces for up to 72 hours. But as long as you binned it properly, and you bagged it regularly each day, then that again will minimise that opportunity. And I'm sure Emily would come in if I've missed anything from that point of view. On markers outside your shop, that's down to you. But talk to your neighbours. Talk to your neighbours and make sure that there's no conflict. But again, I would say to you very strongly, to those people working in the personal care, beauty industry, barbers, do not allow queues to form. There'll be nothing worse than people standing outside expecting to be in for going for a treatment or a haircut they booked in advance, and they're standing outside for half an hour. Avoid it. Start small, build up, minimize the numbers, get comfortable with it, and make sure your staff are comfortable with it as well. That's really important, because they'll have their own concerns, and then start to build those up. But yes, stickers outside, that's down to you. You can talk to your local town council or the bids what areas. But my strongest advice is, in this sector particularly, do not allow the queues to build up, because that will cause a bigger problem for you than if you have a really good measured booking system. I think I've covered everything, but I'm sure you'll come back if I've missed anything.
Absolutely. Thanks, Jonathan. That's great.
Jonathan. Gurdeep and Amy, appreciate it, and you'll be able to speak directly to Steph with regard to markings, etc. with the bid. I've put a link in the chat there for you, which is actually some guidance that we put together about queue management and social distance markings. And also, if any businesses, I agree with Jonathan, obviously for this sector, it would be ideal that you don't have queues outside. But for other businesses, there's some guidance there about how to do it. And also, there's a form there within that guidance about notifying the county council, because you're putting items and stickers onto the highway. We just need, for a safety point of view, to be notified about what's going on there, so that we're fully aware. And obviously it's about making sure that you've talked to your neighbours as well, because they might be wanting to put queue markings outside, and it's all of the details are on that web link for you there.
Thank you very much.
Could I just jump back in one last thing? I know Daryl's got his hand up, but while I'm on a roll, I may as well keep on going, mightn't I? To both Gurdeep and Amy, the great thing about your industry is you know your clients. They're people that come and see you, come and visit you, and they're loyal to you, and they understand how you operate. My best advice to you is to talk to your clients. Have a conversation with them really early. Find out what would make them feel comfortable, and then apply that to the to your business, because that way then you'll be adding that personal care. You'll deal with all those issues in advance, and your clients actually will respect and value you even that little bit more for doing it.
Thanks, Jonathan. It's very comprehensive. Thank you. Daryl?
Yes, thank you. I'm going back to a sort of a point made by, I think, Paul earlier about planning. And a couple of the questions have been sort of aligned to what can I do before guidance comes out, or what can I think about in a wider context. And from my point of view, obviously that's fire safety. Some of these businesses may have been literally closed down for 3 months, and so regular maintenance of things like the fire alarm and any other fire safety active systems that they've got may not have taken place, purely because there's no one there to do it. So we're obviously aware that if somebody's got gaps in their record books that happen to be March to June, then that's going to be something we do obviously see some flexibility on and fully understand. But obviously one of the things that you can do prior to getting specific guidance on whatever premises can and can't open at particular times of day or whatever is just ensure that all of your fire safety measures are in place, are still working, something's been dormant for 3 months, there's a fair chance that a fault might have developed that you're not aware of. If you've got manual systems, then check your manual equipment. Extinguishers may have degassed because you've never looked at them. Fairly unusual these days, but it does happen. And anything that's an active system, so in larger premises it might even be as much as a sprinkler system. But anything that's in place that is just something you would check on a regular basis anyway, get back into that habit, and certainly start with a sort of clean slate from sort of before you open, so that you know it's working when you do open. Yeah. That was it, really.
Thanks, Daryl. Emily, your hands up.
Yeah, thank you. So I just wanted to finish by raising a couple of points, really. So one was building on Jonathan's suggestion of kind of starting small and building up, and you could possibly think about working with perhaps less vulnerable clients in the early days. So if you have, you might have older people or people with significant underlying health risks who are really keen to come back for a treatment, but perhaps if you could just delay them for a week or so whilst you get your kind of rhythm and processes in place, that may help to protect those that are more vulnerable. On a similar point, please also talk to your staff around any anxieties they have, to understand if they've got any underlying health conditions that might put them at risk. And then people from Black and minority ethnic groups as well, particularly Bangladeshi origin, we are seeing higher death rates. So please talk to them specifically about their anxieties as well, and how you can put additional measures in to protect all your workforce. Also think about workforce wellbeing. We've got some resources that we can certainly share with you in terms of signposting to self-help, top tips, as well as local services. And I'm always really keen to engage with the hospitality and the personal care sector on a mental health and wellbeing front, and particularly around suicide prevention. Because you have those close contacts with people, people open up and talk to you about things that they may not talk to others about. So I would just like to put a bit of a plea out there, because we are expecting a surge in mental health difficulties. This will have been a difficult time for many people. So please ask people how they are. Ask them twice, because we're British and we don't always say the truth first up. We may just say we're okay. And actually asking people up front whether they've had any suicidal thoughts is one of the most effective suicide prevention mechanisms, interventions that we have, because it just gives people that permission really to open up and to share, and it gives them an awareness that you recognise actually feeling that way, as difficult as it is to hear, can be quite a normal response really to very challenging circumstances. So they kind of struggle to see another way out, and actually just having somebody that they open up initially to, that can then signpost them to further support, can really be a lifesaver. So thank you. Just wanted to finish on that.
Thanks, Emily. Some final points there. Paul?
Yeah, just a couple of points from me, please, Ian, if I can. What I've said on most of these webinars with businesses and places like that, please talk to your staff, engage with your staff, make sure they are comfortable with what you're asking them to do as well, because we have had over the months numerous calls from people employed in certain businesses about the way their business is being run and the way their managers and bosses have been running it. So please, please, please engage with your staff. Make sure they understand all the practices and the procedures and the safety measures you're putting in place. Make sure they're happy with it, and see if they have any additional concerns, worries, or issues with it that you need to discuss with them, because you really need to be able to resolve those in-house without having to call police or local authorities because of it. So please engage with your staff. The second point really, and it's a sort of a question, but not really a question, so Emily, you don't have to answer this. For the licensing sort of sector, just as an example of things you may have to consider going forward, some very simple examples of glasses. Can you reuse them? Do they have to be washed? Can the same person come up to the bar, get a refill in the glass, or does it have to be taken off them to be reused? If you have door supervisors, can they physically touch people's IDs to check IDs and things like that? Can they do searches? There's all those sort of areas that have to be thought out and gone forward. Hopefully there will be some guidance coming out. And like I said, Emily, you may or may not want to touch on those, but it's more of an example for people to say there's lots of things you need to think about when you're in the licensing sector as well as the personal care sector. Thank you.
Okay, thanks, Paul. We're out of time, I'm afraid. Some really important advice there at the end. We will be showing some useful links at the end here, and if you have any questions that haven't been answered, you can email us at business@warwickshire.gov.uk. That's business@warwickshire.gov.uk with any questions or comments. I'm going to put up some useful web links in a moment, including our information on COVID Secure in the workplace, which picks up many of the links from today, and also a recording of this webinar and previous webinars. It will be up there in the next couple of days. So thank you very much to our panel for your insight today and advice. We hope that for participants this was a useful session for you, and do please refer colleagues and friends to it if you think it's useful. Yes, thank you, and there may be further webinars which we'll be promoting through the usual networks, but thank you very much all, and I'll just put those links up for you now, and they'll be available for the next 4 or 5 minutes if you want to refer to them. Thank you.